Hi, I'm Dr. John Baker. I'm a chiropractic doctor here in Longview, Texas, and today I want to talk a little bit about a clinical entity that has been the topic of some discussion for some time called fibromyalgia. Fibro, of course, comes from the word meaning fibrous or tough. Myalgia refers to muscle pain. Myo is muscle and algia is pain. So it's a painful syndrome that involves the muscles and the fibrous sheath that covers the muscles. And for quite a while, in fact even now, a lot of doctors didn't accept that it's a real clinical entity, that it's a disease in and of itself. More so, they looked at it as if it was just something that people dream up, that they're hypochondriacs and start imagining that they have a real disease. Part of that, some people say, is that there is quite a difference or a range of symptoms that's found between two patients that say they have fibromyalgia. But there are some commonalities that are true, a lot of them. One is this widespread pain feeling. It's kind of like often described as if you had a real bad case of the flu. You know, if you've ever had the flu, you have these aches and pains in your joints, and it seems like all over. You can actually even feel like you've got a skin burn, a sunburn of the skin, kind of that real sensitive feeling of the skin. Another big thing about it is this feeling of severe fatigue, like you're having to push yourself through the day, not just like you're tired. And they often report that they can sleep and still not get restorative sleep. They don't feel renewed. They don't feel like they're rested after they go to sleep. So you have this generalized achiness, this pain in the joints, maybe a sunburn feeling, and feeling of fatigue all the time. You just can't hardly get your work done. In fact, you know, a certain percentage of these folks are disabled. They can't work anymore. And then on top of all this, you know, a lot of them feel like they cannot concentrate. They're in a fog. They're unable to think clearly. Now, there's a lot of comorbid conditions that you often find with fibromyalgia, one being myofascial pain syndrome, also called trigger point problems. Depression also is one that you often find with fatigue, with fibromyalgia, as well as chronic fatigue syndrome. And you know, some might say, well, which causes it? Does the depression cause the malaise, or vice versa? I would be more open to say or opine that if you hurt all the time and you can't only seemingly get through the day, you can't do your job, you have to quit your job because you can't function, you're going to get depressed. People that hurt for more than 6 months become clinically depressed. That's pretty much acknowledged in medicine. So you've got this constellation of symptoms, the fatigue, the pain, the feeling of being in a fog, and it's troubling because there's not really any good diagnostic criteria for it. There's not a cure for it at this point. And then it's more troubling if you're a patient and you go to your doctor, your family doctor, who seems to believe it's all in your head, that you kind of you're lazy and you don't want to work. There's different theories as to why people get this. One is that it may be genetically predisposed, that if your mother had these kinds of symptoms, that you might have these symptoms too. Another one is that there's a dopamine theory, that maybe you don't have enough dopamine or it's not being metabolized properly. And they've used, we want to check something, pramipexole, and it's a drug that they've used to treat things like Parkinsonism, let's see what else, restless leg syndrome, and had some success with those conditions. And pramipexole is what's called a dopamine agonist. So there's some indication in some people's minds that perhaps this is a dopamine-based problem. Another is that perhaps there's abnormal serotonin metabolism, and they've used SSRIs, serotonin selective reuptake inhibitors. They hadn't had a lot of success with that. Another one is that perhaps it's a deficiency in growth hormone, but they've really not had very much success in supplementing with growth hormones. So that looks like that's not a very proper proper link there. There's also an association with folks developing fibromyalgia when they have had neck trauma, car wrecks, get hurt on the job where they fall or somebody hits them in the neck or something happens to their neck, and they develop this fibromyalgia problem secondary to that. There's another theory which is kind of more off the chart, that it's an aberrant immune response to intestinal bacteria. I'm sure that's an area that we're going to see more work on, but right now that's just one of the theories and not one of the major theories. So it's really, for the person that's afflicted with fibromyalgia, it's really problematic. No cure. Sometimes you feel like you're going crazy, because you got all these symptoms and you don't know why you've got it, and your doctor might not believe you. There's no cure, and it can take take a person that enjoyed life, was very productive, and turn them into a person that's depressed, miserable, in pain all the time, had to quit their job maybe, or totally disabled from doing their job, and a person who doesn't enjoy life anymore. And that, whether you believe that it's a real and objective clinical entity or not, the fact that so many people have something that's taken them from being a productive, happy person into a depressed person in pain all the time, who goes from doctor to doctor trying to get relief, trying to get treatment. We need to look at that, because that's a problem in and of itself. Whether it's an actual clinical entity, as I believe it is, or whether it's just something in their minds, whatever it is, it's causing a significant portion of the population, and the estimates are from 2 to 4% of the population suffer with fibromyalgia. It's causing a significant number of people to have problems that are interfering with their function, both as a productive worker and as a family member and as just a citizen who wants to enjoy life and be productive. So I know I've only scratched the surface, and I haven't given you the whole picture, but I hope I've kind of enlightened you a little bit when you have somebody that says, I've got fibromyalgia, what in the world is it, and what can be done for it, and why do you get it, etc. Have a great day. Thanks for watching my video. Bye-bye.